Good morning.
Hello. Can we follow you for today?
Oh yeah, sure, let's go.
What time do you usually start work?
Usually I start around 8-10 a.m.
And do you think about anything before starting work?
Not really. I like to enjoy my slow morning's cup of coffee, and on the commute to work, I just listen to music and just have some me time.
What are you going to do now?
Oh, I'm going to my office now just to catch up on some existing cases to see how they were doing last night, see if there's any new referrals, and also clarify some questions and doubts.
Who are your patients typically?
Oh, there's a wide range, sometimes youth to elderly, but I think majority of my patients are from mid-adulthood to late adulthood.
How much time do you usually spend on catching up on these cases?
Oh, it depends on the cases actually, but I think most of the time I take the first hour of the day to catch up, then clarify questions with the allied health professionals and doctors.
What kind of support for referrals do you usually provide during this process?
For long-term care support, maybe nursing home referrals, destitute home referrals, short-term care support, sometimes daycare services, home services, and if let's say they need continued care in the community for community resources. Or actually, I'm also supporting an inpatient psychiatric ward program, so we actually engage patients in the wards with activities. So one activity we did recently was called the Tree of Life program, and so this activity is where we allow patients to reflect about their social support systems in a more creative way.
How about one misconception people have about medical social work?
Well, I think a misconception people generally have that I also had was that social workers only do financial assessments. And I think they think that, oh, there's not a lot of people aspect to it, but actually that's not true. In my field, there's a lot of psychosocial support, emotional support we have to give to patients and their families. And a lot of times also, even in the financial assessments, we have to talk and connect with them. So that's where all the human aspect actually comes in.
Can you share with us the most fulfilling part of your work?
What's fulfilling is actually, many patients, they come in with a lot of medical attention or medical needs. But beyond that, there's a lot of emotional support, a lot of psychosocial support that caregivers and patients need. And I think what's fulfilling is being able to be there with them, journey with them, process with them, and remind them that they are not alone.
Thank you. What about one challenging part about your job?
I think what's challenging is sometimes I need to balance what is important to me as a medical social worker and what my patient think is important for themselves. And I think the challenge comes in making sure that it's both in harmony while at the same time providing emotional support and ensuring that they do still have autonomy over their own decisions.
What do you do usually after your clinical visits?
Usually I come back to just do some case updates to make sure that allied health professionals know what I discuss with patients so that they're able to follow up more holistically.
Can you show us your ward visiting feed?
Oh yeah, just nice. So usually we go up to the ward with our blazers because sometimes it gets a little cold. Then we bring up whatever we need lah. So today I need my patient to sign some forms, so I brought my clipboard with me and most importantly my mask.
And one last question, do you have any tips for students who are interested in entering this field?
I think it's important to explore what type of working styles work for you, and beyond that to also not be afraid of the emotional side of social work, which many people are, because I think the emotions help you to actually do better and plan a better assessment for the patient. And it's important to also know the why and why you want to be a social worker, because it's the why that is what keeps you going.
Thank you so much for having us
Thank
today.
you, bye bye. Stay healthy, stay lit.